I'm very excited to be here. I've been involved in this community now for just under 2 years, having moved here recently from New Mexico, and it's been quite a transition and very exciting to be able to see all of you and to be working at Stanford and be involved in the effort that all of you have taken on within your communities as well around here. I was asked to briefly share with you, by way of introduction, some of the work that I've been involved in and some of the efforts really from the community perspective before we hear from our wonderful researchers and experts about the important work that they're doing. And I just want to share with you that I received some funding from this work from the Robert Wood Johnson Foundation as well as from the National Institute of Mental Health. At Stanford, which has been a great research institution, my role really was to come in and support our community engagement related efforts, which we've been working to build support to become better partners with all of you and to provide additional collaboration with our families and communities around the area as well. I'm a child and adolescent psychiatrist by training, and so most of the work that I've been involved with has really focused on support for young people. And I've been very concerned about the lack of access to service and support for young people, and also with the notion that half of all mental illnesses start by the age of 14, 3/4 by the age of 24, and yet many children, almost 80% of those young people that have a mental health issue are unable to access care for a variety of reasons. And it's been very important for us to think then, how do we build these supportive models of early intervention in an effective way, particularly when we want to be involved in prevention and also early mental health support as well. The stigma issues, as have been mentioned, are just a huge issue, and we thank the people for bringing change to mind, for their support and guidance in building this effort. You know, particularly for me in the child mental health field, it's been very hard, I know, for many families of children that have mental health issues to be able to often be the voice that they would like to be because of the issues they have getting access to services, dealing with schools, dealing with multiple systems to get the support for their children on a regular basis. We face situations such as this, which was the shirt the young man was wearing behind me in line at the ice cream store in Palo Alto. And when I asked him, so why did you get that shirt? And it was, well, he was going to a party and he thought it would be fun. And it just, to me, reflected sort of the lack of recognition and understanding in our general community and the work we still have to do on a huge basis to be able to build broader support and awareness around these issues. We talk a lot about parity, but as you all know, and as the recent NAMI report just really focused on, we have a great deal of work to do to build broader parity, and particularly also in the children's mental health world. We have a huge need to expand our recognition and support to help young children with their mental health issues get the support they need, get the workforce support that they need as well, and build that focus. This is a slide from England, with a young man with depression and the issues that one faces around bullying and stigma for our children in schools. And the depression issue has been a big one, certainly in this community. And I will tell you, in my role, before I moved here in New Mexico, I was involved quite a bit in youth suicide prevention across our state with many different cultures and communities, and now have moved to Palo Alto, where we're again facing these same issues in a very painful and difficult way as well. As you know, probably 1 in 5 children may have a serious mental health issue, and for many of them it's an issue related to depression and mood disorders, and Dr. Singh will be speaking more about these issues in a little while. But understanding that for young people, particularly around suicide, 70 to 90% of the time that young person who takes their life has a mental health issue that may or may not have been recognized before, just highlights the need for additional education and support in this area. I've been fortunate to get involved with some of the community response in the Palo Alto area. Project Safety Net is a great network of the school district, the city, many community partners, our colleagues at Stanford and Lucille Packard, working together to build a variety of supports that range from training in suicide prevention for the students in the school, as well as their families, the teachers, and everyone involved. The development of the Sources of Strength program to take student leaders and help them develop their skills to be able to be better peer supports for their colleagues as well. And then the Herd Alliance, which is a network of professionals from a number of organizations that have been very involved in building broader-based support and education for the community. We've been doing quite a variety of events for families and students as well in the district, and really particularly targeting different cultural groups, because for me, and particularly being from New Mexico, very often the solutions and supports around breaking down stigma and building support are rooted in cultural solutions and in multi-generational types of interventions. So we've been very involved in looking now at even more targeted ways to build support among the different cultural communities in our neighborhood as well. I became involved in early intervention in a new form over the last 4 or 5 years, and I spent many years working in schools and school-based health centers as a child psychiatrist around New Mexico, saw children mostly in middle schools and high schools in an integrated model with primary care providers, teaching pediatricians, family practice doctors, how to ask about mental health issues when they saw children with different issues in schools, and how to build those kinds of supports. And it's only been within the last 6 or 7 years that for me, there's been learning about how to build early intervention support for people with serious other psychiatric conditions like psychotic illness, schizophrenia-like issues as well. And as I came to be involved in this work, I learned that in fact internationally, there's been a great deal of work going on in this area for a very long time. And in fact, our country still has a lot of work to do to catch up to work being done in Australia and New Zealand and across Europe in terms of building broad systems of early mental health support for our young people. In fact, there's an international declaration around building mental health support for young people that was started with the World Health Organization that most people in the United States aren't aware of in terms of building these kinds of models of early identification and intervention for young people with serious mental health issues. I had the fortune to be involved in a program called EDIP, which was focusing on providing support for young people with early warning signs of a psychotic illness where they might be getting ready or close to losing touch with reality as a result of that. And we were able to provide a great deal of support for young people with early warning signs of those kinds of conditions. And this model has been replicated in a number of other cities around the country and in 4 or 5 counties actually here in California as well. It's a model that we're continuing to see grow. And then the RAISE program that National Institute of Mental Health funded supported a study in 34 different cities across the United States in terms of looking at support for young people with very serious psychiatric illness beginning to have a first episode of psychosis as well. So we have these models that have actually now led to our federal government investing in building these first episode programs across the country. This last year, we had an additional 5% support for early mental health and early psychosis that our federal government passed for every state. And these models are taking place now on a very large degree. We're seeing the numbers grow to 100 of these programs across the country. And, we won't even go back that slide. So what I would just say is in California, we now have 18 counties that have one of these types of programs for people with early prodromal symptoms. Or here in San Mateo County, there's the PrEP program for people with an early episode of psychosis. And one of the things we're really trying to do is build the connection across the state and organize and build the support so that every county can have both a program for people at risk of psychosis as well as a program for people with a first episode as well. We're working actually now with national partners to build a national network of all these programs so that we can create common ways of training sites to do this work around the country, organize the treatment to make sure folks are doing it the same way, and then looking at collecting data from all of these sites that are taking place across the country as well, so we can really show the benefit and derive the best practices to help build the support as well throughout. As I close, I just want to mention one of the other international models we've been excited to be thinking about building. This is the Headspace program in Australia, where they've built 80 of these standalone centers for 12 to 25-year-olds across the country, are going to 100 for early mental health support. They've been very exciting to learn about. Young people go in on their own or with their friends because they've done such a wonderful job of building direct marketing support to young people and doing an incredible work of breaking down stigma, telling young people to go in for a breakup, go in for anxiety in language that supports young people as well. So now we're seeing 65% of the people going to Headspace sites on their own or with a friend. And, one of my hopes, and we've had a little bit of funding to look at what it would take to start a model like this in the Bay Area as well, where we could really shift the culture towards early support for adolescents to get early health and mental health care in a very supportive way in a system that we really don't have in this country at this point in time.